Being parents is one of the biggest desires of the people, and we can say that it is one of the most beautiful feelings in the world. Even we need to accept that we have a limited opportunity in terms of the children we can take care of in today's conditions. Especially we are obliged to educate our children in the best way in all senses and to be able to raise good people for the society. This is why we decided to inform you about the family planning as well as birth control methods in this article. What is the goal of family planning? What should I do? The family planning allows families to have a certain amount of children on the time when they want. You have to take the advantage of birth control methods in order to be sure that your family planning will work. How many groups exist in birth control methods? The birth control methods can be classified into two groups as traditional and modern methods. How the traditional methods applied and can they succeed? The traditional methods are withdrawal method, determine the time of ovulation with the calendar calculation and maintain the breastfeeding. They have high failure rates. What are the modern methods used in pregnancy control? Modern and acceptable methods are birth control medicines, birth control needles, vaginal rings, intrauterine devices, barrier methods such as preservative and diaphragm, chemicals such as sperm killer foam and gel. What are the ways to preserve from pregnancy permanently? Does surgical intervention needed? There are surgical interventions such as the tubal ligation in women and channel ligation in men. In which periods should I pay attention to birth control? Pregnancy protection is a process that continues until the menopause, starting from the adolescence. What is the risk of unprotected women? What kind of methods should be applied if a woman doesn't want to get pregnant? Who should be applied for the appropriate method? 80 to 90% of women who did not use anything to protect themselves during the sexual intercourse can become pregnant within a year. This is why you should take the advantage of one of the effective methods in case you do not want to have a baby in the close future. You need to contact a gynecologist to choose the most appropriate method for you and the person you are with. In this way, you will have a customized protection. The main role of condoms is to prevent the semen, sperm, from reaching the egg. It serves as a barrier to make sure that there will be no fertilization occurring. Condoms for males can feature lubrication and spermicide which will kill the sperm cells quickly and efficiently. To use the condom effectively, it is advised that the condom should always be worn before having sex, since sperm is likely to appear even before the man's ejaculation or climax. Aside from preventing pregnancy, condoms help stop sexually transmitted diseases from spreading. Always remember to use condoms, even when having oral sex, since it can be a route for STDs. Condoms must be rolled on properly before sex and withdrawn immediately after ejaculation. Female condoms. A female condom is worn before sex by inserting it inside the woman's vagina. It is typically made of a synthetic rubber called nitrile. Just like male condoms, it also serves as a barrier to prevent pregnancy and sexually transmitted diseases. How to use? Carefully take the female condom out of its pocket. Do not open the package by using your teeth or any sharp materials to prevent it from being damaged. The condom's smaller ring has to be squeezed at the closed end and then inserted carefully in the vagina. The penis needs to enter the female condom. Gently pull out the condom immediately after sex, to prevent the semen from leaking out. Throw the condom in a trash can and remember not to flush it in the toilet. Thanks for watching. Like and subscribe.